Imagine a quiet morning at the clinic. You roll up your sleeve for a routine draw, and a week later, the results hit your inbox. Blood sugar, normal. You exhale. This sense of security masks a difficult reality. That number can stay stable for years, while beneath the surface, your body loses a biological fight it never warned you about. Type 2 diabetes rarely arrives with the sudden intensity of a heart attack. It behaves more like water seeping into a basement, a slow, quiet accumulation of damage that takes years to trigger a single warning. This raises a central mystery. If a multi-organ system is slowly failing, how does the blood sugar stay within a healthy range for a decade? A normal lab result often acts as a facade. It conceals a desperate, escalating struggle for survival, occurring within your tissues every hour of the day. To understand this deception, we have to look at a healthy metabolism.
Every time you eat carbohydrates, they break down into sugar that enters your bloodstream. This circulating sugar is useless unless it can reach the interior of your cells. However, those cells behave like secure facilities that require a specific signal to grant entry. Your pancreas manufactures that signal, a hormone called insulin. When insulin triggers the docking port on a cell, the gateway slides open, allowing sugar to pour in for fuel or storage. When healthy, this process happens rapidly. The sugar clears the blood, and your blood sugar gauge smoothly returns to its baseline level. This efficient signaling system is the exact mechanism the body eventually uses to hide the progression of its own disease. The first failure begins with insulin resistance. Over time, the docking ports on the cells grow unresponsive, effectively rusting and ignoring the insulin signals that used to work. Your pancreas tries to brute force the situation, flooding the bloodstream with massive insulin, hammering the rusted ports until they open. On your charts, this creates a deceptive balance. Blood sugar stays normal, while insulin production spikes into a warning zone. You have entered the silent phase. On paper, you appear healthy, but your pancreas is already working dangerous overtime shifts just to maintain the appearance of normalcy. The cause of this cellular unresponsiveness often traces back to visceral fat. This is the dense tissue wrapped deep within your abdomen, surrounding your internal organs. Visceral fat behaves like a leaking factory. It constantly drips inflammatory signals and fatty acids directly into the liver through a private vascular channel called the portal vein. Between meals and while you sleep, your liver performs a secondary role. It slowly releases stored sugar to keep your body fueled. But a fat-soaked liver grows deaf to insulin, continuously pumping sugar into your blood at 3 a.m., ignoring commands to stop. The pancreas never gets a break, forced to pump a massive counterstream of insulin to neutralize this unearned sugar hours after your last meal. Your skeletal muscles represent the largest sugar-absorbing tissue in the body. They are designed to soak up the vast majority of fuel following a meal. When muscles remain inactive or become marbled with fat, they lose their absorbency. They effectively turn into dried-out sponges that refuse to take in circulating sugar. With your largest sponge closed for business, high volumes of sugar stay stranded in the blood. This places yet another burden on the pancreas to ramp up insulin production to clear the blockage. Physical movement is the single largest mechanical intervention point for this system. It determines whether that sugar burden is safely absorbed or dangerously amplified. A biological machine forced to run at maximum throttle for years eventually faces a breaking point. Inside the pancreas, specialized factories called beta cells produce your insulin. Under the constant strain of high fat and high sugar, these fragile cells begin to falter and shut down from total exhaustion. This is the disease's hinge. After a decade, beta cells fail and insulin supply drops off a cliff, causing blood sugar to violently spike. This triggers glucotoxicity. High sugar actively poisons the remaining cells, driving insulin lower and sugar endlessly higher. An official diagnosis captures the moment your body's internal defenses have finally been overwhelmed. The disease didn't start with the test result. The test result simply recorded the point where the compensation failed. It is often difficult to accept that such a collapse is happening when you feel no pain. This lack of symptoms actually proves that your body's hidden compensation was working. The entire goal of that decade-long overtime was to keep your blood sugar normal, and normal blood sugar feels like nothing at all. By the time the classic warning signs like extreme thirst or blurred vision appear, a significant portion of your pancreatic function has already been lost. There is an empowering reality to this slow timeline. Because the disease takes years to break the system, the early stages are highly forgiving. During the silent years, changes to activity and weight can resensitize the receptors on your cells, effectively clearing the rust from those docking ports and allowing the liver to heal. Lowering the internal flood of sugar and fat gives exhausted beta cells the crucial window they need to recover and resume normal function before they reach the point of total failure. A normal test result captures a single moment of successful compensation, masking the immense strain required to maintain it. These silent years are an opportunity. By learning to listen to the quiet strain of your body today, you can interrupt the cascade long before the medical test ever has to raise its voice.